like to extend our heartfelt gratitude to all our partners and stakeholders whose unwavering support and collaboration have been instrumental in bringing this mobile clinic to fruition. It is through your collective efforts that we can strengthen the healthcare provider network in Rizal province and beyond. And as we embark on this journey to expand access to healthcare services, let us remain steadfast in our commitment to serving the Filipino people with compassion and excellence. Together, let us strive for a bagong Pilipinas. Bawat buhay ay mahalaga. Maraming salamat at muli magandang umaga po sa atin lahat.
Master's degree in International Development from Cambridge University. Her initiatives drive meaningful impact to state.
About 30 years ago. We are currently active in 90 low and middle income countries all over the world, and we leverage private sector to ensure that we offer affordable and accessible sexual reproductive products, services, and rights to some of the most vulnerable populations all over the world. Now, DKT Philippines also already started 30 years ago.
Of course, how helpful po itong mga ganitong mga initiatives na ito ng private companies like DKT for reproductive health?
Well, since family planning is one of the programs of our department, the provision of this kind of facility will be somehow will help our department in the implementation of the family planning program. Mm-hmm. So instead, this will give access to people who cannot go to facilities for family planning procedures, no? Because the DOH also purchase our own family planning supplies. No? We procure our own. We have our short method, we have long method, we have permanent method like vasectomy and ligation. And this clinic is, I saw the clinic, I saw the facility. No? It's well equipped, and it will really help people who desire to undergo family planning. So, malaking tulong po ito sa kanila.
Yusek, of course.
So, I was asking the director a while ago if there is a possibility of expanding this not only for Binangonan but all throughout the nation.
Yun nga po, kasi I understand nga po na family planning is one of the key programs of Secretary Herbosa. Of course, yung partnership ng ang DOH and the private sector is essential po. Pero of course, there will be critics. There will be critics ng family planning program, of course, the Catholic Church, for example. So how will you, paano nyo po maano to?
Well, we have to respect the religious, sa mga religion and the culture of the people. No? We still have to respect them. So, ito namang ginagawa ng DOH is para ma-prevent natin yung mga infections, and then yung desired family size ng mga pamilya, hindi naman natin kinokontrol yan. No? Ang sa atin lang, iniiwasan lang natin yung pagkakaroon ng pagtaas ng maternal mortality, yung mga infant mortality. So as of now, with the law that we have, na-reduce namin ang maternal mortality and infant mortality because of this program. No? Kaya napakaganda rin itong program na to dahil at least we are doing this for the safety of especially mga mothers natin, mga anak natin.
Yusek, malapit na po yung budget season, on a few months na lang po. Meron na po bang planned budget ang DOH sa RH program po?
Yes, actually we are still in the process of preparing our budget, no? In anticipation.
Are we expecting increase po ba? Are you hoping for an increase po ba?
For
increase sa budget po sa RH?
That depend on the data that we have, no? So if we see to it that there's a need to increase, then we have to propose an increase in the budget. Sabi ko kanina, nakita ko yung loob ng mobile clinic, no? It's really it's an amazing facility. Actually, it's my first time to see this kind of facility, and I really appreciate the effort of DKT in partnering this kind of project with local government units. That's why ang sabi ko nga, with this project na na-launch ngayon, I hope they can be able to expand this to other LGUs throughout the country para mas makakatulong sila sa Department of Health in terms of the implementation of this program.
Yusek, may iba tayo tungkol sa pertussis po. Kamusta na po yung kaso ng mga pertussis?
Well, ang pertussis natin, I'm happy to inform you na because of the active immunization program na ginawa natin sa burn, no, ay bumaba na po yung ating pertussis and measles. Kahapon, nagkaroon kami ng action review of what happened dun sa aming measles outreach immunization program. I'm happy to inform you na doon sa report ng ating mga kasamahan sa burn ay malaki na po ang pagbaba ng kaso ng pertussis sa measles.
Yusek, kamusta yung targets nung vaccination sa farm so far?
Ang report po kahapon, nalista po natin ng 95%, no? 95%. So, 95% na po ang nalista natin sa immunization. Konti na lang po yung hindi nababakunahan.
Is the DOH planning to extend the vaccination campaign?
Well, continuous naman to eh. No? Tuloy-tuloy naman po itong pagbabakuna natin. Kaya lang, siyempre, may mga problema po tayo in terms of, siyempre, culture na naman, no? Yung belief ng ating mga kababayan. But we continue to find ways para to see to it na lahat ay babakunahan for the protection of our children.
How important is the partnership between, okay, we already discussed the partnership between the LGUs, but the Department of Health, the national government, and of course private sector partners like you. How important is it? And of course, talking about units of the bus, how many units are you going to explore in the coming years? Are we expecting 2 more? How many more this year?
So those are many questions in one, so let me tackle them one by one. So first of all, we are extremely grateful for the support from the Honorable Secretary of Health and the Undersecretary here today as well. What DKT Foundation does and what the mobile clinic does very much fits into the 8 pillars of action that the Secretary of Health has implemented as well. And that is really our point. We are in a position to make sure that we provide sustainable funding through a mobile clinic that can help support the gaps that the Secretary of Health might currently be experiencing, right? And so we see that especially in the remote areas of the Philippines, people are not accessing services, whether it's because they still can't afford the highly affordable trust or whether they can't reach the LGU. So for us, it's crucial that we don't duplicate what the National Ministry of Health is doing or that we stand in the way of what the National Ministry of Health is doing, but that we integrate into their very inclusive agenda and we help support that by leaving nobody behind. Yeah. Yes.
Denise, how do you select